Hello and welcome to the Brain Health Series brought to you by ChiroPro Performance Center located in Acton, Massachusetts. My name is Tina Rizecki and I am the Rehabilitation Director and host of your show.
At ChiroPro Performance Center, we treat a wide variety of neurological, metabolic, and biomechanical pathologies. We implement a three-pronged approach to treatment: functional neurological applications, clinical nutrition and supplementation, and corrective biomechanical therapy. In this presentation series, we will be exploring the neurological evaluations, applications, and treatments that we offer. We utilize state-of-the-art diagnostic testing, including comprehensive balance testing and video-recorded eye movement evaluations to assess the integrity of your neurological system. Our equipment allows us to look at the integrity of your brain in an objective, unbiased manner. Along with a comprehensive neurological and biomechanical physical examination, our intake testing provides us with a very individualized and unique window of your neurological system. Because of our very meticulous intake testing, we have the unique opportunity at our clinic to offer you an individualized and specific treatment program. Our treatment plans are different for each person because our treatments are unique to each person's specific areas of dysfunction. Finally, our treatment employs a non-pharmaceutical, non-surgical approach to neurological rehabilitation and therapy. This means that our treatment can target the root cause of the problem without the possible side effects of traditional medical therapies, including medication. But before we discuss the neurological basis of our treatment applications called neuroplasticity, let's begin with a background of concussions and why post-concussive syndromes can be debilitating and cause severe, life-changing symptoms. It's important to know that there is no universally accepted definition of a concussion. For the purposes of this presentation, we will identify a concussion as a biomechanically induced, transient disturbance of neurological function that may or may not be associated with the loss of consciousness. A concussion is a form of mild traumatic brain injury that is induced by a transmission of force to the brain from either a direct or indirect impact to the head, face, neck, or somewhere else along the body. Concussions are not only the most common and familiar type of traumatic brain injury, but they are also one of the most puzzling of neurological disorders. The mystery lies not in the diagnosis of the condition, but rather in the nature of its pathophysiology. While neuropathological changes may frequently occur in post-concussive syndrome, these changes are neither consistently present nor necessarily associated with the induction of a concussion. This implies that a concussion is a disorder of function rather than structure. For many people that suffer from the various symptoms after a head injury, it may be very demoralizing and frustrating at times because the imaging procedures like MRIs and CT scans that are performed on people with post-concussive syndrome usually come back negative. Many people are left with unanswered questions regarding the cause of their symptoms as their condition worsens. At our clinic, our intake diagnostic testing is specialized to identify areas of dysfunction, weakness, or imbalance at a functional rather than structural level. Our testing procedures allow us to challenge your nervous system with different tasks and movements. Depending on the integrity of the brain function that we are testing, we can then identify if there is an issue with the input, integration, or output of those areas of the brain related to that function. To summarize this very important point, most head injuries usually affect the functioning of the brain. For example, one neurological change that can occur after a concussion is in the frequency of activation of neurons on one side of the brain relative to the other side. This creates an imbalance of integration and output in the brain, and that can lead to severe symptoms. Even though MRIs and CT scans are usually negative in concussions, they are still warranted, especially shortly after a moderate to severe head injury, to rule out the possibility of a structural pathology like a brain bleed or a fracture in the skull. Let's talk about the mechanism of injury that occurs with trauma to the head and neck. Forces that occur to the head and neck as a result of an impulsive head motions are believed to be directly responsible for concussions. While the type of force incurred by the brain is important, the manner in which the brain responds to the force is just as significant. There is considerable evidence that the primary cause of concussions is the acceleration loading experienced by the brain at the moment of contact. While the brain is highly resistant to changing its shape in response to slow or transient forces, the brain deforms quite easily when abrupt, shearing forces are applied due to the physical properties of the brain itself. Rapid head rotations generate shear forces in the brain, and therefore, rotational and acceleration forces applied to the skull have a high potential to cause shear-induced damage to brain tissue. What this means is that the nerves and neurons in the brain get stretched from the rotational force, causing damage and inflammation to those areas. The most important aspect of traumatic brain injury mechanisms to remember is that it is not necessary for your head to be impacted to cause a neurological concussion. This is very important, so I want to say this again. It is possible to sustain a concussion without hitting your head. This can occur if a force of enough magnitude is applied to the neck or body, causing a violent whiplash and inducing rotational forces that may cause shearing and rotational trauma to the axons in the brain, causing a concussion. This can occur in events like an automobile accident or sporting events. This is why it is imperative to be properly assessed and evaluated for a possible concussion, even in the absence of hitting your head on something, especially if you have symptoms associated with a concussion. Now, what are the symptoms that occur in post-concussive syndrome? Every concussion is unique, so one person may experience very different symptoms after a head injury compared to someone else. However, there are common patterns that occur with concussions in different magnitudes and frequencies. Among the most common symptoms after a head injury are headaches, dizziness, vertigo, severe fatigue, blurry vision, brain fog, lightheadedness, changes in emotion, anxiety, aggression, insomnia, and depression. In addition, there is usually some form of general cognitive impairment, including difficulties in memory recall, concentration problems, and balance issues. The treatment of traumatic brain injuries provides a very difficult challenge to doctors because of the unique nature of the pathology of concussions. No two concussions are the same, and therefore, no two concussions should be treated in the same way. Post-concussive syndromes can have one or many symptoms in varying degrees based upon a number of variable factors. These factors include the number of previous head injuries, the functioning of your brain before the head injury, the type of trauma causing the head injury, the elapsed time since the injury, your age, and many other factors. All of these variables can change the nature and expression of your concussion, and this warrants the necessity of a specific, individualized assessment of your neurological system. The evaluation of traumatic brain injuries takes time, which some clinics cannot provide. At ChiroPro Performance Center, we provide ample time and interaction to fully evaluate and understand the unique dynamics of your head injury. Because of the complexity and difficulty associated with treating concussions, it is imperative to know why the treatment we can offer you is viable. Historically, doctors and physicians thought that the human brain was unable to change, that whatever you were born with or however your brain was functioning at a certain period of time, the structure and function of your nervous system was static and unadaptive. However, through modern research and breakthroughs in the understanding of the nervous system, we now know that the brain is able to change its functioning, integration, and output. The brain is constantly updating and adapting from the inputs that it receives from our 5 senses and specialized receptors within the brain itself. This idea that the brain's integration and output of sensory information can be altered, changed, and trained is called neuroplasticity. The principles of neuroplasticity are the reason that our treatment is able to change your symptoms and give you your life back. However, although your brain can adapt and change to improve function, it can also adapt to have less function In other words, neuroplasticity can be good or it can be detrimental. This bad neuroplasticity is what occurs after traumatic brain injuries. Allow me to explain. There are three basic principles of bad neuroplasticity with regards to concussions. These are learned non-use, dysrhythmia, and the uniqueness of neurons themselves. Concussions result in decreased functioning and health of certain neurons and the circuits that they are integrated in. When this occurs, the decreased health of neurons leads to decreased function and the absence of gross neurological disease. In other words, if you had an MRI, a CT, or other imaging procedures after a traumatic brain injury, the imaging usually comes back negative because there is nothing structurally altered after a traumatic brain injury, like in a stroke or tumor process. Instead, there is a loss of function. This loss of function causes your brain to utilize other, healthier pathways instead of the diseased pathways. This is called learned non-use, and it can lead to severe symptoms. With appropriate treatment, we can retrain the dysfunctional pathways to reintegrate and balance the output of the brain. The next principle of bad neuroplasticity that occurs after head injuries is called dysrhythmia. This occurs when one or more of the brain's rhythms gets out of sync with the rest. This is referred to as a noisy brain, and this leads to difficulty concentrating and brain fog due to the brain's inability to differentiate strong, sharp signals from background noise. This lack of neural timing can be retrained through the therapies and rehabilitation exercises that we offer at ChiroPro Performance Center. The last principle of bad neuroplasticity associated with traumatic brain injuries is the uniqueness of neurons. Neurons have the amazing ability to form, unform, and reform circuits constantly. In traumatic brain injuries, neurons unform connections to surrounding neurons, causing less communication and less integration. With treatment, we can create more connections and integration that leads to a greater function. It must be remembered that function is a result of entire neural networks firing, not individual neurons themselves or their connections. Our treatment changes the integration and expression of neurons and the networks that they are involved in. To summarize the principle of neuroplasticity, your brain's integration and output can be changed to alter the functioning of your brain and body. However, we can utilize specific therapeutic modalities and rehabilitation exercises to reverse the detrimental changes after a head injury and change the health and integrity of neurons at a functional level. This allows us to offer a unique, specialized treatment approach to concussions, one that can rewire and reintegrate the circuits of your brain back to normal integration and output patterns. Let's look at an example of what we just discussed in a clinical application. The first graph I'm showing you now is an example of one of the tests we run on every patient during their initial examination. This specific test is from video nystagmography testing, or VNG testing. The VNG tests different eye movements, and video records your eyes and graphically displays the eye movements as well. This is a graph of a specific type of eye movement. For this eye movement test, this is what a normal graph should look like. The graph should resemble a jagged edge like a bread knife or like shark teeth. The next graph is the initial graph of a patient who sustained a concussion playing sports. As you can see, this graph looks dramatically different. For the majority of the test, there are no jagged edges and the line is basically straight. This means that the patient's eyes were not moving appropriately during the test, and that can be interpreted as that part of the brain that controls or creates that eye movement was dysfunctional. You can see one little area where there was an appropriate response, but for the most part, the patient was unable to have an appropriate functional output. After 4 weeks of treatment, this is the graph of the same test during the patient's re-examination. As you can see, there is a dramatic difference in the response. Now the graph resembles the normal graph and is much more appropriate. The normalization of eye movements means that their brain function was changed through treatment, and now that area of the brain is functioning at a higher level and is able to interpret and function more appropriately. Understand, this is just one test of many V&G tests and only one specific evaluation of the brain of numerous during the entire examination. We do not judge or base our diagnosis and treatment on one finding. However, this is a great example of our ability to train and change the functioning and integrity of the nervous system through specific individualized therapy applications and rehabilitation exercises. Today, we discuss the importance of functional neurological evaluations and the treatment options of head injuries and post-concussive syndromes. If you are seeking treatment for symptoms following a head injury or for other neurological disorders, it is imperative that you receive a comprehensive neurological evaluation assessing the integrity and functioning of your brain. At our clinic, we offer specialized objective diagnostic testing and specific individualized treatment applications for many neurological conditions, including post-concussive syndrome. If you suffer from dizziness, lightheadedness, motion sickness, psychological issues, balance problems, blurry vision, difficulty concentrating or brain fog, or other symptoms associated with post-concussive syndrome, then it is very important to have your neurological system assessed to ensure that it is functioning properly. Thank you for joining us for this presentation.
Here's Dr. Lynn Carlson with more of what we do at ChiroPro Performance Center.
Hi, I'm Dr. Lynn Carlson from ChiroPro Performance Center in Acton, Massachusetts. ChiroPro specializes in brain-based rehabilitative services. We specialize in post-concussion recovery and a comprehensive evaluation that really targets area of the nervous system that isn't functioning properly after a concussion injury. We use what are called brain-based therapies to try to really maximize neuroplasticity in the nervous system. Similar to a muscle that needs strengthening after it's been injured, we want to find areas of the brain that aren't functioning well and develop a unique and individualized, comprehensive, brain-based rehabilitation plan for each of our patients to really maximize the ability of their brain to recover. Sometimes after a concussion or a brain-based injury, patients have brain fog, confusion, headaches, dizziness. These are all symptoms that oftentimes aren't showing any things on an MRI or a CAT scan, but yet there's still a functional problem where the patient just doesn't feel good and aren't able to really perform life the way they want to. That's where we come in. Oftentimes our patients have already seen some of the best medical providers and they've been cleared on MRI and CAT scan imaging, but we really still want to help them get the quality of life they deserve. At ChiroPro Performance Center, we have many diagnostic tools that allow us to look at eye function, balance function, and cognitive abilities, and design a program that's going to really strengthen those neural connections and get people back to the quality of life they want.
For more information, please visit our website, www.chiroproperformance.com. Our doctors are always available for a free 15-minute consultation to discuss how we can help you with your healthcare needs.